Now by Dr. James Smith in London. He's an emergency doctor and lecturer on humanitarian studies at the University College London. Thanks for being with us, James. So we're just hearing there some updates from our correspondent on the ground. We are hearing that potentially ambulances are lining up near the border to start transporting patients. What are you hearing from medical professionals on the ground there? Are they starting to get news that patients may be able to start leaving soon?
Yes, I mean, it sounds like there is some slow movement, but as you've already reported, the number of patients in need of medical evacuation is much, much higher than the number that Israel is alleging will be permitted to move through the Rafah crossing on any given day. The last time that I saw the Rafah crossing was when I passed through in April of 2024. About a month later, of course, the Israeli forces invaded the city of Rafah, occupied the border crossing, and destroyed the crossing. Israeli soldiers were posting footage of their feats online publicly. For the last 2.5 years, we have seen the most extreme violence committed against the Palestinian people. Approximately 200,000 injured. Many of those have wounds that now require surgical, medical, and rehabilitative care that is no longer available in Gaza. And of course, many more with chronic medical problems, patients with dialysis needs and cancer, as you've mentioned, who require treatment that's no longer available inside Gaza. For as long as Israel continues its strategy of ongoing direct military violence in Gaza, coupled with ongoing efforts to undermine access to healthcare in Gaza. And again, as your reporters have mentioned, the major news in the last couple of days has been that Israel will proceed with banning Doctors Without Borders, MSF, from working in Gaza and throughout Palestine, and likely many other organizations as well. We have to understand all of these dimensions as part of the same strategy. Undermining healthcare capacity inside Gaza, undermining Palestinian sovereign control over the healthcare system, unsealing the border in a way that appears like an act of charity. We have to be very clear, this is a legal obligation. It's a right, not a privilege. All of this is part of a wider strategy on the part of the Israeli regime.
James, you mentioned just the sheer numbers of people who are needing medical evacuation and comparing that to the numbers of people that Israel is saying they will allow out each day, only 150. We have 20,000 patients waiting to leave, 4,500 of them being children. I mean, what kind of situations are those people in? I mean, they're certainly not mild cases. They need to be medically evacuated. So how much pain and how much suffering are those people in and have been for some time?
Absolutely. We're talking about patients who were wounded in the first days of the genocide, some of them waiting for medical evacuation, since October of 2023. Despite the best efforts of Palestinian healthcare workers and the Palestinian healthcare system, it's clear that many patients have been left with untreated pain, with chronic infections, with non-healing wounds, non-healing fractures, medical problems that have deteriorated precipitously. Patients with cancer, of course. If there is a delay in access to treatment, surgical reconstructive interventions, or a delay in access to chemotherapy, radiotherapy, this can have catastrophic consequences. Patients can die, and indeed more than 1,000 Palestinians have died waiting for medical evacuation. That's most likely a gross underestimation of the total number of Palestinians who've suffered by virtue of Israel's imposed blockade of the medical evacuation pathways.
And I mean, this is just the first day of this reopening, but it's important to note that this is not a reopening without immense rules and regulations imposed by Israel. We've seen just 5 patients having approval so far. So What hope do you have that this is going to progress in a way that does allow all of those people to be able to leave? And what's it going to take to make sure that Israel does adhere to this, which we have to remember was a requirement of the ceasefire deal that Rafah was reopened?
We need concerted and coordinated political intervention to hold the Israeli state accountable. Flagrant breaches of the ceasefire agreement, flagrant breaches of international law, genocide, of course, being the overarching crime against humanity that against which all of this is to be understood. It's very difficult to conceive of Israel making any concessions that aren't to its strategic advantage. As your reporter earlier has mentioned, the border crossing isn't being opened for humanitarian aid. Again, Israel has a legal obligation as the occupying power to ensure that aid enters through all available crossing points. And as you say, this is a crossing that is now heavily militarized. Israel always maintained some control over the Rafah border crossing. Even if they weren't physically present, they would engage in vetting of humanitarian workers and others that were coming and going through the Rafah crossing. Now they have an on-the-ground physical military presence, heavily militarized. People coming and going need to go through various security checks, various scanners, all of their belongings checked. This is a crossing over which Israel has no legitimate right to exert control. We need an independent body, either through the existing humanitarian system, or another independent party, completely detached from Israel and its allies, completely detached from the illegitimate board of peace, to manage this process in a way that is safe and dignified for the Palestinian people.
Dr. James Smith joining us there from London, emergency doctor and lecturer of humanitarian studies at the University College London. Thanks so much.